Sacral torsions. What are they? How do we name them? This video is going to basically go over those two main topics. So realize that the sacrum is at the bottom of the spine. This bone here that kind of looks like an upside down triangle with the tailbone at the bottom and the lumbar spine at the top. If I basically make a small version of the lumbar spine, like so, where the spine's on top of the sacrum, whenever the spine bends backwards, has essentially this motion here when you're arching your back, your sacrum, to stay on the lumbar spine, needs to tilt forward. And then when that happens, it creates a smooth curve rather than a hinge that might crimp the spinal cord and cause injury. And likewise, when the spine bends forward and you're rounding your back, the sacrum tilts backwards. So the spine normally should move that way. The sacrum should normally move that way. And with rotation and side bending, there's other subtle movements that the sacrum itself can do. Now, when we normally talk about sacral dysfunction or abnormal movements of the sacrum, or a sacrum being stuck in an abnormal position, we talk about it as far as a left on left, right on right, left on right, or right on left sacral torsion. And a torsion is a little bit different than that straight forward-backward movement of the sacrum. So the sacrum here, if I take a pen and don't put it straight vertically up and down, but more on a diagonal, like this, that would be the axis that we would have the sacrum to move on. Now, the sacrum right now is facing up and down. The pen is from the top right base to the left inferior lateral angle, or ILA. And because this axis would be called the right axis, if the sacrum was turned and rotated to the right along that axis and stuck there, we would call it a right rotation on right axis, or right on right sacral torsion. Vice versa, if we had the sacrum on the axis over here and it was rotated to the right, where this side is more prominent, now we have a right on left, because this is at the left sacral base and the other end of the axis is at the right ILA. So this would be a right on left sacral torsion. So the first right or left direction is which direction the sacrum is rotated. If you're looking at the person from the rear, is it rotated to the right or is it rotated to the left along that axis, which is either at the right sacral base, which would be a right axis, or the left sacral base, which would be the left axis. So that's how the sacrum should move, and that's how we name a sacral dysfunction.